All right, so I'm going to spend a few minutes talking about the overview of accelerated resolution therapy. And this overview is taken from the book chapter in Posttraumatic Stress Disorder and Related Diseases in Combat Veterans. This is the chapter specifically on accelerated resolution therapy. And so, as you know, accelerated resolution therapy is a relatively new therapy that includes many techniques for resolving traumatic memories associated with post traumatic stress. And this therapy stands out because it incorporates a variety of therapeutic techniques like imagery, metaphors, and elements of Gestalt for addressing traumatic memories. The protocol constitutes two parts. There's the basic protocol, which is focused on single incident trauma, so things like a car accident or a assault of some kind, or sexual or physical assault, any kind of single incident trauma, surviving a natural disaster, hurricane, house fire, anything like that. The advanced and enhanced protocol goes a step further and is useful in exploring complex events and developmental issues with the aid of the metaphors and the Gestalt techniques for deeper exploration. So the basic protocol is useful for when the stimulus or the cause is very obvious, the cause being that single incident episode. And that cause would elicit some kind of very intense, very strong kind of reaction. And so when you have something that's really obvious like that and very visceral, flash is also useful. So you'll use your judgment in terms of which protocol you would follow if you were trained in either. And if you're following the principles of art, as you'll learn as we continue here, you can better delineate which procedure might work better. I have found for complex trauma that the art protocol or a variation of that is much more effective simply because oftentimes there really isn't a specific event that a person can identify. It's more of a series of events, it's more of a general time in a person's lifetime where they were bullied or harassed, or they lived in a household with a person who had mental health problems or alcohol problems, or they simply were just ignored, not otherwise given love and attention that you would get in a loving household for whatever reason. So, also with the type of symptoms that complex trauma elicits, it's visceral. You have anxiety, but again, you can't really point to a specific episode that is contributing to the discomfort. So when you're doing work with the general effects of something like a difficult childhood, then you would be focusing more on the emotion, you would be focusing on themes. So the theme of shame or the theme of intense embarrassment, and you would have a person bring up imagery related to those types of episodes. The art procedure does have the elements of exposure and desensitization. So there is this initial period or phase in the treatment where you need to bring up a distressing memory. So that's part of what happens with reconsolidation. You need to have some kind of activation of some kind. If you're doing flash, you're trying to avoid that activation, but you are bringing awareness to that activation. So you get that activation and then you regulate that by shifting the focus to some kind of positive imagery then that settles down the nervous system, and then again you return to viewing or recalling mentally the difficult situation as part of that exposure. So you've got a specific traumatic experience identified for that single incident trauma, or you have a theme identified if it's more general and along the lines of complex trauma or symptoms that would stem from complex trauma. And you could use the ACEs to identify experiences that you might focus on, or you could use the PCL score to identify what kinds of episodes to focus on, or you could also use the self-compassion assessment to identify thinking patterns that you might focus on. So the guided eye movements help the therapist guide the client through decreasing intensity of the memory. The eye movements are very interesting because they generate a calming effect in the amygdala, in the fight-flight center of the brain. It just does. It's like I can do this and pick up something. It just does. So I focus on something calming, and in general, with my eyes moving, in general, that brings everything down. And in Flash, you don't have to necessarily do eye movements or even tapping, but it's that imagery that's helpful. And the eye movements really do add a layer of positive effect to that calming and assists with the exposure and desensitizing. Okay, so then there's the director's intervention, and this is where we're engaging in voluntary image replacement or re-scripting. So the component, or rather the main purpose of that is to help reinterpret what occurred and to view the episode from a different perspective. So you might re-script an accident, like a car accident, as something that never happened. So it may be that you're treating a person. I've encountered this several times where a person has a difficulty driving a certain stretch of road, and either they came into a panic attack for whatever reason, and then that part of the road is now continues to be difficult. I had one client who had this type of difficulty coming down from Mount Hood, and if you remember what that's like at all, there's a stretch when you're coming off the main part of the mountain, the tall part of the mountain, and the road opens up and you see the expanse of the mountain range in front of you, and it's very wide open. It's like a view you would see in an airplane, only you're in a car and you're holding the wheel and you're rounding the bend, and it can be a little unnerving. So this type of experience can be a source of reprocessing that we use the director for, to imagine that there is no kind of distress. So it might be that I would give a person a prompt of focusing on a time where they're driving and they don't have that experience, or a time before they had their panic attack is most useful. So I will direct them to think about a time when they were able to take that curve and did not have any type of sense of alarm. And so we would do the re-scripting on that piece, and then through repetition, and generally with difficulty with traveling by car and activation due to a car, being in a car, that I have found takes 3 or 4 sessions before that changes. Although I did have someone who had a 40-year-long history of driving phobia and just would never drive, and she wound up seeing me, and we had 3 scheduled sessions. She did 2 of them, and after the second one, she left me a phone message telling me that she wasn't sure, but she found herself just spontaneously getting in the car and driving across town, and she didn't think she needed another appointment, and we were good to go. So that was pretty cool to see that shift happen for that person. So then if it's something like from childhood, then we would reference the ideal parent protocol exercise and the 5 pillars. And maybe you've had your client run through the ideal parent exercise a few times so they have a sense of what this new reference point is. Should it be that I accept something that's unacceptable, or should I imagine what is more supportive and focus on that for my re-scripting? And so when you do re-scripting, you do want to check in and you do want to see how it went and see, does it intuitively make sense? Does it reinforce autonomy and agency and safety and these elements that a person would have rather have had? And in art, the instruction would be to imagine having the episode occur in the way that you would have wanted, or something along those lines. Then there is the resolution and the metaphorical interventions, and this is where we check for lingering distress from the original episode, and we also switch back and forth, kind of like that thing you do when you get your eyes examined, which looks clearer, A or B, A or B, or something like that, but at any rate. So you check for lingering distress of the original event. If there is any, then you address the images that are associated with that lingering distress. And you would address that by using some kind of a metaphor where you would simply guide your client to get rid of the image. So in art, it would be imagine erasing the image and painting over and then replacing it with a positive version of that image. I often like to suggest that they're in a museum and these images are up on a wall, and that they can imagine going in there very aggressively and assertively and deciding, I do not need these images anymore, and pulling them off the wall and throwing them into a wood chipper. And I love the image of a wood chipper. It's very visceral, very loud. Lots of stuff comes out the other side that you can use to plant flowers and raise a beautiful garden. So you're checking for these images that are left over, any distressing images that are left over, and then comparing the before and the after versions to see which one feels more visceral. And again, you're getting rid of any related anxiety. And then you're also doing mental rehearsal, or in art it's called target trigger times, and you're focusing on what the situation will be like the next time you're reminded of it or the next time that you are in it. And so finally, you are, again, looking at an entire traumatic memory. You are aiming to alter the emotional impact through this structured protocol that includes eye movements and re-scripting. And then all of a sudden, the memory is modified from its original version, and it's been formatted to better fit your vision of yourself. And now it's your turn.